Okay, let's unpack this. Today, we're diving into something really fascinating, sparked by a listener, Mr. Chan. He sent over some compelling articles and videos, specifically a piece by Dr. Linji Liang in Master Insight from November 2024, and also a YouTube video from Dr. K, health expert, around the same time. Both are suggesting that certain high-end supplements with Hirudin can actually reverse clogged arteries. Pretty big claim. Now, Professor Lin, whose work on oral Hirudin we've, looked at before, he's asking a really critical question about these new claims. It's all about how this Hirudin is supposedly delivered. Are these claims backed by science, especially when you compare injection versus taking something orally? This is where it gets really interesting, and it's a great chance to flex our critical thinking muscles.
It really is. And what's fascinating, as you mentioned, is Dr. Lin Jiaolang's article. It's titled High-End Supplements Reverse Clogged Arteries. Sounds promising. And it actually cites a 2025 study, something about biomimetic nanoparticles co-deliver Hirudin and lumbrukinase. Very cutting-edge stuff. But here's the kicker. If you actually go and read the methods section of that specific paper, it states, clear as day, the mice were intravenously injected through the tail vein. They even have a diagram showing it. A mouse, a needle, an injection.
Injection. Wow, not exactly swallowing a pill then.
Not at all. It's direct injection into the bloodstream.
So the evidence they're pointing to uses injections, but the products being sold, the ones Dr. Lin and Dr. K talk about, those are oral supplements.
Rest is the claim, yes.
It feels like a huge leap. You have Dr. Linji Liang described as a doctor of medical sciences, and Dr. K on YouTube using these really good analogies suggesting, instant clearing of blockages, almost making it sound like heart surgeons might be out of a job soon. So is this just a simple misunderstanding of the science, or are they kind of glossing over that crucial injection detail?
Well, that brings us right to the core scientific issue here, the delivery method. And the scientific literature, honestly, is incredibly consistent on this point. Hirudin is what we call a polypeptide. Think of it like insulin. It's a complex protein structure, a delicate chain.
Okay, like insulin. I know you can't just swallow insulin, right? You have to inject it.
Exactly, and for the same basic reason. When you take a polypeptide like Hirudin orally, it hits the stomach, the digestive tract, and the environment there is harsh. It breaks the structure down, degrades it. So it simply can't get absorbed into the bloodstream in an active, effective form, not in any meaningful concentration anyway.
So it just gets digested like food protein.
Pretty much. And this isn't just theory. Study after study confirms it. Research on using Hirudin for chronic kidney disease or pulmonary hypertension. They all use parenteral administration.
Parenteral? Meaning injection, essentially.
Yes, subcutaneous intravenous, basically bypassing the digestive system. Injection. There's even an upcoming paper, December 2024, looking at Hirudin formulations. It explicitly says that oral preparations usually lead to, well, decomposition, breakdown.
Okay, so let's pull this together. What does this all mean for someone hearing about these supplements?
What it means is the scientific papers Professor Lin has flagged really highlight this stark difference. It's the difference between injected Hirudin, which the studies show can work in specific contexts, and oral Hirudin, which the science says gets broken down before it can do much.
So the evidence supporting Hirudin's effect is based on a delivery method completely different from the supplements being sold.
Precisely. The science is quite clear. Effective delivery requires injection. Mice, rats, potential human applications. It's always injection in the successful studies. Oral delivery fails because, again, it's a polypeptide. It gets destroyed by digestion. This isn't some minor technical detail they forgot to mention. It's a fundamental barrier.
It's like expecting your skin cream to work by eating it instead of applying it.
That's a good analogy. The delivery method is absolutely crucial. And connecting this to the bigger picture, it's just a really powerful reminder for all of us, for you listening. Always be critical of health claims. Don't just look at what a substance might do in a lab dish or even in an animal study. Ask how it was delivered in that research. Does that method match the product they're trying to sell you?
That delivery question seems key.
It is, which really leads to a final thought. In this world packed with high-end promises and miracle supplements, how can we get better at spotting when the crucial science, like the delivery method, is being, let's say, conveniently overlooked or maybe just misunderstood? Something to think about.